Hello everyone, this is Dr. Ginger Garner. I am back here with you to share a few more tips and tricks. Now today's video is gonna really focus in on people who can't move very well. Now, that doesn't mean you're young or old or fit or not. We're talking about situations where pregnancy is one, where there's so much weight here in the front, which you don't have to be pregnant to have a bunch of weight in the front. There's so much weight here, it really tightens up stuff back here. And you feel like it's back pain, right? You feel back pain back here, a feeling of restriction or tightness. But when you really get down to it, it feels like you can't expand your back ribs. So just take a second, breathe. Do your back ribs expand when you inhale without chest breathing? So not this, not chest breathing. I want you to put your hand here. Chest should stay still, and when you inhale, my back ribs expand like bucket handles out to the side. You can see that. But my chest is not rising. I'm not stress breathing. I'm not pain breathing. So if you can't do that, or if when you try to do that, it doesn't work very well, or things feel tight, or you have pain that goes kind of here, next to the spine itself, which is an area where the quadratus lumborum runs, if that feels tight back here, you might benefit from this. If you've had hip arthroscopy or another similar surgery where you've been on crutches for a while or an assistive device for a while, this is definitely going to lock up on you. It's going to feel tight, restricted, spasmed, just generally pissed off, right? So if you can't move very well, that's what I'm talking about. You've had surgery, you're pregnant, things are really progressing along. Any of those conditions where you just can't move that well, then there are some things that you can do. What I'd like to show you is to address that and learn to breathe in that direction. You can do two things. One, if you're pregnant, you can't really stretch and move, that well. If you've had a hip scope, same thing. There's a lot of limitations. So if you've had a hip scope or you're pregnant, you can do this, generally, depending on where you are after your surgery. Most people can get on hands and knees. You're going to do threading the needle pose, which is a yoga-based pose, where you're going to dive through with one hand. You're going to put your shoulder up on the blanket and your head off. Now you can put one hand over your head. You can put it here to hold you up. If you're more flexible, which is probably not the case if you're pregnant or have a hip issue, you can drop it behind you, or you can reach behind you this way. A word about people who've had hip scopes. You're going to have to cross the opposite knee from the direction which you're turning. So you turn, you twist this way, but this ankle goes over the other one. And you're going to bring your knees wider. You have to do that. So you have to at least be a month or so out of a hip scope to be able to do this. And even after your hip scope rehab, you still may have to position your legs this way. From that point, right here, this is our target, right here. So put your hand here if you can. I'm going to use a particular yogic breathing technique. Cut against the grain breathing. Exhale first. Inhale. Get your back ribs to expand. Hold your breath. And then exhale. Inhale. You should feel the back ribs expand here. Hold your breath. 2, 3, 4. Exhale. 2, 3, 4, 5, 6. Inhale. Hold. Exhale. 2 more breaths. Inhale. hold, exhale. Slowly press yourself out of it. So what we did there was against the grain breath with threading the needle. I want you to use a blanket for this to take the stress off of the neck. There are a couple of indications where you couldn't do this. If you're pregnant and baby has already turned head down, so you're past about 34 weeks, I wouldn't do this one. Okay, talk to your pelvic PT about what you can substitute instead, because we don't want baby flipping and going breech. So after you're about week 34, particularly week 36, if baby's already head down, I call that locked and loaded, I wouldn't do this particular one. I want to do it on the other side just to give you a chance to see it again. When you are working on your breath, so again, shoulder on, head off, breathe into the back ribs, cross the opposite ankle over from the direction you're going. You're going to inhale for 4 at least 4 counts. Hold, feel your back ribs expand here, and exhale. Notice how I'm also making some noise with that breath. You can do inhale, hold, 2, 3, 4, now exhale. More of a sighing exhale. Last one, inhale, back rib expansion and elongation, hold, and exhale. So we really have about a 4-4-4 breath as you press yourself out. You'll inhale for 4, no chest breathing, only back rib expansion and belly expansion. Then you'll hold the breath for 4, and then you will exhale for 4. And I would really encourage you to exhale for longer than 4 counts. You can use a or a sigh or a hum. That will help you really reset your stress and pain response. It's going to deepen your breath a lot, and it's going to improve what you're feeling through the pelvic floor, the respiratory diaphragm, and the low back. Overall, using that breath technique will really help you dig deeper to relieve stress, pain, and tightness in that area. So until then, take care of yourself, and also look for part 2 to this video series, which is one more thing you can do to address restriction and tightness in this area, and even feelings of pain when you can't move that well.